for this quiz program. As you all know, as the name suggests, this is the quiz only for the postgraduates. So those who have passed the examination, you cannot write the exam. Is it clear? Okay. Second thing, please write your name and Ksos IDs at the top of your score sheet. So those papers without your name and Ksos ID will not be evaluated. Number 3, as you know, this is a team event. So some of you won't be having your teammate. So you may be writing the preliminaries as single. You can still write the examination, but we will not evaluate the paper. So we will have a preliminary for screening you people for 25 questions. And from this, we select the best of the five teams. And they will be having the finals. So, is it clear? Any doubts? Okay. So, with this, it is my pleasure to welcome today's quiz master, Dr. Akshay Nair, a well-known oculoplastic surgeon from Mumbai. And he has conducted a lot of quiz programs across the country and also in the international level in the World Ophthalmic Congress. And it is our pleasure, Dr. Akshay Gopinathan Nair, to this program. Over to you, sir.
Thank you, sir. Thank you, Dr. Bastian, Dr. Marian, for the invitation. Can we switch over to mine? Can we switch to the presentation, sir? Yes. All right. So it is my distinct honor. This is my 4th time conducting the KSOS TACO quiz and the 2nd time at this venue. So it's a great pleasure. I've had the honor of having conducted the State Ophthalmic Society quizzes for about 7 or 8 states, but I can tell without doubt the competitiveness, the discipline and the rigor with which KSOS conducts their quiz is unparalleled. The absolute adherence to the rules, the level of the students and the answers that they come with is phenomenal. Okay, so we have from 8 a.m. till about 9:55 for the quiz. So we'll start in a couple of minutes, and the first elimination round that we have is the prelims. We'll have 25 questions and I'll explain the rules over here for you. We have 25 questions. You can see on your paper there are 30 answers, but we won't go to 30. So in the prelims, what you will have is 25 questions. 1 to 20 will be MCQs with the correct option, either A, B, C, or D. You need to enter that right answer just as A, B, C, or D. If you've entered something and you feel you want to change it, scratch it off completely and write the new answer. One scratch out and a correction is accepted. You can't write A, scratch it, B, scratch it, C, scratch it, and then write D. That means, you know, you're really unsure, so we won't honor that. Just one time, if you want to change it, you can do that. Now, if you see questions 21 to 25 written, these are pictorial questions. You'll see a picture and there's a 1 or 2 word answer that you need to write. The top 5 teams will then qualify for the finals here on the stage. Now, if in the prelims there is a tie, questions, the number of questions that you've got right from 21 to 25, these are our tiebreaker questions, they will decide which team goes through. If that is a tie again, then we go and start from question number 1, and that's called a sudden death. The team that gets their first wrong answer as we go serially from 1 to 20 gets eliminated, and the team that gets the maximum streak of right questions go through. In the prelims, there is no negative markings. You can answer whatever you want to answer. And if you feel that later on when we show up the answers, there's something wrong or something, these are questions that we've come up with and we vetted to the best of our knowledge these are correct. So that will stay that. We will not be entertaining any disputes regarding that. All right. So I still see some teams who've just come in writing their team names and papers. So I hope you've had the time to write your names and your IDs and everything. And as sir said, the rules are simple. As long as you've appeared for the exam or you're still a resident, but have not passed your MS or DNB or your degree, you're good to go and you're an eligible candidate for the quiz. Okay. Nobody else is walking through, so we're good to start? Yes. We are using an honor rule. We will honor you with your word and allow you to keep your mobiles. We don't want to do a exam style invigilation where you have to deposit your phones at that, but only on the condition that we trust that your partner will or you will not quietly look up ChatGPT and come up with the answers. So yeah, please don't do that. All right, so we're all set to go. What I will do is keep a timer with me, so I keep each question for about 25 to 30 seconds, not more than that, because I don't think for an MCQ you need anything more than 20, 30 seconds. All right. So with that we go. All ready? I didn't hear you all. Yes, okay, good. Okay. So question number 1 is the main mechanism of in CRAO where you have to do an ocular massage. Why do you do an ocular massage in CRAO? Is it A, to increase the perfusion pressure? Is it B, to dislodge the emboli distally? Is it C, so you can reduce the IOP? Or is it D, to increase the collateral pressure? The question is, it's a little confusing wording. The question we are asking is, why do you do massage after a CRAO? To increase the perfusion pressure, to dislodge the emboli, to reduce the IOP, or to increase contralateral flow. You just need to mention A, B, C, or D. All right. So we've had 30 seconds for that, and we'll move on to our next question. Which mutation is most commonly associated with early onset primary open angle glaucoma? Is it A, MYOC? Is it B, OPTN or the optin gene? Is it C, CYP1B1? Or is it D, TBK1? Which mutation is associated with primary open angle glaucoma? MYOC, optin, CYP1B1 or TBK1? All right. We've had enough time for this. We go to question number 3, which is the earliest field defect in a chiasmal compression from pituitary adenoma is typically, is it A, superior temporal defect? Is it B, an inferior temporal defect? Is it C, a junctional scotoma? Or is it D, a nasal step? So you need to visualize that pathway that goes and where the tumor is pressing, causing the vision to get disturbed at which part, and on perimetry, what kind of field will you end up seeing. All right, we are done with 30 seconds on this question. Our question number 4 is, which eyelid tumor is most associated with Muir-Torre syndrome? Is it A, BCC, which is basal cell carcinoma? Is it B, SCC, which is squamous cell carcinoma? Is it C, sebaceous cell carcinoma or sebaceous gland carcinoma? Or is it D, Merkel cell carcinoma? How many of y'all are aware of Muir-Torre syndrome, just read about it? It's there in Kansky, so I'll give you that. All right. So we come to question number 5. This is definitely there in Kansky, I know for sure. Which is the most common systemic association with scleritis? Is it SLE, systemic lupus erythematosus? Is it sarcoidosis? Is it C, RA or rheumatoid arthritis? Or is it D, GPA or vaginas? GPA is granulomatosis with polyangiitis, which is the most common systemic association with scleritis. All right. Does anybody know why Wegener's name has been changed? Who said that? Nazi. Okay. So we'll keep one audience prize for her later on. We'll see if she's correct. She is correct, but we need to know if she gets the question also correct. So Friedrich Wegener was a pathologist from Germany who did his work and research on granulomatosis in Germany during World War II on patients or victims in the concentration camps. And later on, when people came to know about this, they said, we don't want to have anything with his name. So therefore, his name is no longer associated with this disease. It's called granulomatosis with polyangiitis. All right, that is enough on that. We'll go to our next question, which is the primary component of a drusen is A, lipofuscin, B, complement proteins, C, calcium hydroxyapatite, or D, collagen. We see this day in and day out and we just write it when we see some vague yellow thing on the fundus, drusen. But what is it actually made of? Lipofuscin, complement proteins, calcium hydroxyapatite, or collagen. With that, we move on to question number 7. The strongest predictor of visual recovery following optic neuritis is which one of the following? Is it the visual acuity at initial presentation? Is it the enhancement pattern seen on imaging? Is it the retinal nerve fiber layer thickness seen on OCT? Or is it the absence of pain at the time of presentation? Which of the 4 is the strongest predictor of visual recovery, which means the better the parameter here, the better the visual recovery, or the worse the parameter here, the worse the visual recovery. All right. Question number 8. In uveal melanoma or choroidal melanoma, the feature that is most associated with metastasis or beyond tumor spread beyond the eye is A, the location of the tumor, B, the level of pigmentation of the tumor, C, the presence of monosomy 3 on analysis of the tumor cells, or D, is it the presence of more subretinal fluid indicating a greater metabolic activity? So which of the following features of a uveal melanoma is more statistically associated with metastasis? The location, the pigmentation, the genetic features seen in the cells, or the morphological appearance of fluid? All right, we go to question 9. ARN or acute retinal necrosis is most commonly caused by which of the 4 viruses? Is it A, CMV or cytomegalovirus? Is it B, EBV or Epstein-Barr virus? Is it C, VZV or varicella zoster virus? Or is it D, which is HHV6? The full form I have forgotten. All right. So question number 10, we'll bring the level a little lower so everybody gets this right. The most common benign orbital tumor in children is it a dermoid cyst? Is it a lymphangioma? Marian is smiling. Is it C, a cavernous hemangioma? Or is it D, a capillary hemangioma? The most common benign orbital tumor seen in children. Dermoid lymphangioma, also known as venolymphatic malformations. Cavernous hemangioma, also known as cavernous venous malformation. Or a capillary hemangioma. All right, we go to question 11. Which layer is involved in corneal hydrops? Is it the epithelium? Is it the Bowman's membrane or the Bowman's layer? Is it the Descemet's membrane? or is it the corneal stroma, which is the actual site of the pathology in corneal hydrops? A, B, C, D, epithelium, Bowman's, Descemet's, or stroma. All right, we go on to question number 12, which is the design, which lens design reduces the occurrence of PCO or posterior capsular opacification the most? Is it a biconvex shape? Is it a flat back design? Is it a square edge design? Or is it the change in the material of the lens itself where PMMA has lesser PCO rates? Which of the following 4 features of the lens design reduces the rates of PCO the most? Biconvex, flat back, square edged, or PMMA? All right. Question 13. Juvenile xanthogranuloma commonly affects which part of the eye? Is it the lens? Is it the optic nerve? Is it the eyelid? Or is it the iris? This is juvenile xanthogranuloma, not to be confused with other diseases that have the word xantho in them. Which part is most affected? The lens, the nerve, the eyelid, or the iris? We go on to the next question, question 14, which is the best imaging modality for a patient where you are suspecting a carotid cavernous fistula? Would you request for a CT of the orbit with contrast? Would you request for an MRI of the orbit with contrast? Or would you go in and want to do an MR venogram that focuses on the vasculature? Or a DSA, also known as digital subtraction angiography? So which of the 4 would you recommend or request to the patient that will have the highest possibility or probability or positive predictive value of picking up that carotid cavernous fistula? I think I've given a lot of clues in the answer, in the question. Question 15. While you're doing a cataract surgery in an elderly patient, the most important risk factor for intraoperative floppy iris syndrome is consumption of which of the 4 groups of drugs? Is it finasteride? Is it calcium channel blockers? Is it tamsulosin? Or is it ACE inhibitors or angiotensin converting enzyme inhibitors? The most important risk factors for intraoperative floppy iris syndrome. All right, question 16 is, which is the most common cause for inherited pediatric cataract? Is it Stickler syndrome? Is it Lowe syndrome? Is it connexin 50 mutation? Or is it Marfan syndrome? The most common inherited cause of pediatric cataracts. We're not talking about sporadic cases or other trauma-associated cases. This is only inherited causes of pediatric cataract. All right. Question 17. Again, a simple one. The most commonly implicated organism in traumatic fungal corneal ulcers is A, Aspergillus species, B, Fusarium species, C, Candida species, or D, Curvularia species. The most commonly implicated organism in fungal ulcer following trauma. Which of the following 4 is it? All right, question 18. What percentage of the population will have a cilioretinal artery? 8% of the people, 13% of the people, 25% of the people, or 33% of the population? This is extremely important when you're dealing with conditions like vascular occlusions to know what percentage of the population will have a collateral in the form of a cilioretinal artery. 8%, 13%, 25%, or 33%. All right. 19. Below what CD4 count level usually is CMV retinitis seen in immunocompromised patients? You have an immunocompromised patient. What is the CD4 level below which you'll have to actively look for or even preemptively treat for this condition? Is it your CD4 count being less than 100 cells per mm cube? Less than 200, less than 50, or less than 400? Less than 100, less than 200, less than 50, or less than 400 is the CD4 count level below which CMV retinitis is seen or is a presumed risk factor. All right, your last of the MCQs is in Marfan syndrome, which subluxation pattern is most typical? Inferonasal, superotemporal, inferotemporal or superonasal. In Marfan syndrome, which subluxation pattern is most typically seen? Inferonasal, superotemporal, inferotemporal or superonasal. All right. So now, don't give me long essay answer questions. You only have one box. So just one or two words. I don't want to know everything about this condition. Just the answer that we're looking for. These masks were used in medieval times to treat or presumed to treat what condition? Just give me a short answer. Don't give me the epidemiology and morphology and all of that. Just a small word. This is not your theory exam. All right, 22. Recently, there's been a lot of discussion about this. This was published just last week. Subretinal photovoltaic implant to restore vision, and the vision improved was almost 3 logmar lines. But in what group of patients? I want a specific answer. Don't say severe visual impairment. Yeah, of course, severe visual impairment, but nothing like that. I want a specific answer. This was a photovoltaic implant or a retinal implant that has restored vision, reported to be restoring vision of up to 3 or 4 logmar lines in patients with blank. What have I blanked out? A short, maybe 1, 2, 3 word answer, not more than that. That itself is a big clue. All right. 23. What is this device? And no, it is not a foreign body that you've retrieved from the eye. This is something that we put in a surgery. What is this device? All right? I won't dwell too much on it, because if you know it, you've already written your answer. If you don't know it, the answer is not going to come at you. 24, again, what is this device? It is not a carom board. It looks like one, but I can assure you it is not. All right, and your last question, what beverage comes to mind when you see this scan image? Yeah, it's a little unusual question. What beverage comes to mind when you see this unusual question? What I'm going to do is go over each question for just 3 seconds, back to front. This is the question where you write the beverage that comes to your mind. Name this device that you use in some sort of a surgery. What is this device that is implanted? 22 was about the subretinal implant. 21 was about masks in medieval times to treat a condition. 20 is about the subluxation in Marfan's. 19 was about CMV retinitis and CD4 level. 18 was serioretinal artery. 17 was the most common organism in fungal corneal ulcer. 16 is the most common inherited cause of pediatric cataract. 15 is the most important risk factor for intraoperative floppy iris syndrome. In carotid cavernous fistula or CCF, what is your specific modality that will give you the most positive predictive value? Juvenile xanthogranuloma is affecting which part of the eye most commonly? The lens, the nerve, the lid, or the iris? Which lens design has found to reduce the PCO rates the most? Biconvex, flat design, square edge, or PMMA? Which is the which is the layer that is involved in the corneal hydrops? Is it the epithelium, the Bowman's, the desmase, or the stroma? Which is the most common benign orbital tumor in children? Acute retinal necrosis is most commonly caused by which organism? In uveal melanoma, what is most associated with metastasis? Which feature of the tumor? What is the strongest predictor of visual recovery in optic neuritis? What is the main component of a drusen? And I remember by question 5, we still had some few people trickling in. So for their benefit, the most common systemic association with scleritis is SLE, sarcoidosis, rheumatoid arthritis or GPA? Which eyelid tumor is most commonly associated with Muir-Torre syndrome, basal cell, squamous cell, sebaceous cell, or Merkel cell? Which is the earliest field defect in chiasmal compression from a pituitary adenoma, superior temporal, inferior temporal, junctional, or a nasal step? Which mutation is most commonly associated with early onset POAG? And finally, what is the main idea behind ocular massage following CRO? Is it to increase the perfusion pressure, dislodge the emboli, reduce the IOP, or increase the collateral flow? I would request our volunteers to go around and collect the answer sheets. Please make sure your names are written. We cannot go back and get your names because we will have unidentifiable papers, unless of course you think you have done so bad that you don't want your name to know. Just give us your answer sheets and we will go over them and correct them.
എല്ലാവരും റൈറ്റിംഗ് ബോർഡും കൂടെ കൊടുക്കണം. പിന്നെ പേര് എഴുതിയില്ലാത്തവർ എഴുതണം. പ്രത്യേകിച്ച് ലാസ്റ്റ് വന്ന ആൾക്കാർ അറ്റൻഡൻസ് വയ്ക്കാനുണ്ടെങ്കിൽ അതുകൂടെ വയ്ക്കണം കേട്ടോ.
Yeah, disconnect please. Great. Okay, we can reconnect now. Perfect. All right. Thank you so much. Okay, so have we gotten all the answer sheets back with us? Anybody still with their answer sheets? Nobody? There, we collecting the last answer sheet there, or we done? All done. Okay, great. So we'll go over the answers and y'all will have an idea of how well y'all have scored or how, what is the kind of score y'all expecting. All right. So in our main round, I actually had only about 4 or 5 audience questions, but then I've been told that there are 50 audience prizes. So we'll be a little generous and we'll start giving them out right now in the morning itself. So what is the main mechanism of CRO following ocular massage? Why do we do a massage? Let's see a raise of hands. How many feel it's increasing the perfusion pressure? How many feel it is dislodging the emboli distally? How many feel it's reducing the IOP? And finally, what is the increase? Is it increasing collateral flow? No, I think everybody got it right. It is dislodging the emboli distally. Although it has a dual mechanism, it does reduce the IOP also. You'd understand if you're compressing the eye. But reducing the IOP is not the main goal in this. It is to dislodge the emboli. All right. Which mutation is most commonly associated with early onset primary open angle glaucoma? I thought this was simple. How many feel it's option A? Few of them. How many feel it's option B? How many feel it's option C? And how many feel it's option D? So majority are still unsure. Oh, I don't know what I wrote. I'm not going to raise my hand. Because I've seen about only 10 hands raised across all 4 questions, all 4 options. It's MYOC. Now how many got it right? See, this is classical behavior of not knowing but kind of sure. All right. So what is the earliest field defect in a chiasmal compression? Superior temporal defect? Inferior temporal defect? No one. Junctional scotoma? No one. Or nasal step? The earliest. Okay, now how many of you all got it right? Hey, y'all are not being honest when I'm asking you initially. Y'all can raise your hands. Remember, there's no negative marks. Okay. Muir-Torre syndrome, nobody said they have heard of it. So how many have said basal cell carcinomas? And how many have said squamous? How many have said sebaceous? And how many have said Merkel cell carcinoma? Nobody? Has anyone seen a case of Merkel cell carcinoma? No one? I've seen one in 15 years. So it's actually sebaceous cell carcinoma. Yes. I told you. All right. I hope everybody got this right because this is absolutely important. SLE, how many feel it's SLE? How many feel it's sarcoid? How many feel it's rheumatoid arthritis? And how many feel it's Wegener's? We had a big discussion on Wegener's. It is rheumatoid arthritis, and I want our first audience prize to be given there. If you can introduce yourself. You have a mic for Yeah, so she got it right, even though the answer she got right, but the main part was that I asked was GPA. Your name, ma'am?
Yeah, I'm Dr. Vaishna Megha, finally a resident, Comtrust Eye Hospital, Calicut.
Excellent. Congratulations.
Thank you.
You can give our first audience prize to her. The Nazi heritage, a big round of applause. The Nazi heritage of Wegener's has led to his association with this condition being dissolved. Question number 6, the main component or primary component of drusen is lipofuscin, complement proteins, calcium hydroxyapatite, collagen. Okay, so this one I think people may have got it wrong. It's actually complement proteins. Apolipoproteins is the most common component of drusen, not lipofuscin. Lipofuscin is a pigment material, not a protein material. All right. What is the strongest predictor of visual acuity in optic neuritis? Visual acuity at presentation? 1, 2. Initial presentation is improving. Huh? No. 4, 5. Enhancement pattern on MRI? No. RNFL thickness at diagnosis? No. Or absence of pain? 1. Okay, so the rest are just going to give steroids without bothering what it is. So it is actually your initial visual acuity, which also decides whether you will respond to steroids or whether you will improve with complete recovery. This was one of the secondary outcomes of which study? Who said that? No, you have to be a participant, ma'am. Okay, we'll still give a prize there. Ma'am, yeah, if you can on the mic introduce yourself, we'll have the second audience prize.
I'm Dr. Remya, pediatric ophthalmologist.
Okay, so this you had to know. Anyway, we'll go ahead and give her a prize for the audience prize. The study that investigated, the first study that looked at factors affecting the outcome and the role of steroids in optic neuritis was ONTT, and its association with which systemic condition? Multiple sclerosis. And then enough, one prize per question. I can't keep giving out. Multiple sclerosis is correct. Uveal melanoma, the most common feature associated with metastasis is how many feel tumor location? Whether the ciliary body, whether the iris or the uvea, posteriorly the choroid. No. Pigmentation level, melanotic tumors are more likely to metastasize than amelanotic tumors. No. Monosomy 3, 4 hands, or subretinal fluid indicating higher metabolic activity. Others are just waiting. I don't want to raise my hand. I have written C, but let me see. Because if you've written C, you're right. Monosomy 3, which is a test that you need to get performed done on the tumor cells after your initial diagnosis or enucleation or even an FNA biopsy will decide how often you need to monitor them and what is the investigations you need to monitor. All right, ARN. You can shout out this answer, it's simple. A, B, C or D? B. CD? DD? C is correct. All right. The question that made Dr. Marian happy, since both of us are oculoplastic surgeons, the most common benign orbital tumor in children, dermoid cyst. How many say dermoid cyst? How many say lymphangioma? How many say cavernous hemangioma? And how many say capillary hemangioma? So capillary hemangioma has a few hands. Capillary hemangioma is the right answer. I am about to ask a question, but I am afraid. All right, it is not in our rest of the quiz. So what is the treatment of choice for capillary hemangioma? Propranolol. I saw the hand go up here. So can we give out one more audience prize here? Our lady in the front with glasses, please, you can introduce yourself up here. Propranolol in an initial dosage of 1 to 2 milligram per kg. Please introduce yourself. Given for 4 to 6 weeks or 1 week after near total resolution.
My name is Deepthi Roy. I am from RIO Trivandrum, final year PG.
All right. So all the final years are getting these awards, the audience prizes. Okay, which layer is primarily involved in corneal hydrops? This was simple. Stroma, right? No, it's the Descemet's membrane, which when it breaks, it causes stromal edema, but it's not the stroma that itself is there. Which design reduces PCO rates the most? Biconvex shape, flat back design, square edge design, PMMA material. Okay. So our capillary hemangioma got this one wrong. It's not PMMA material. It is square edge design. The square edge rests more firmly on the posterior capsule, preventing the migration across the edge of the lens, the migration of the epithelial cells that have been left behind. All right, JXGs, juvenile xanthogranuloma, affects the lens? No. Does it affect the nerve? No. Does it affect the lid? Yes. Or does it affect the iris? This is also one of those I am not raising my hand question. While the lid is also affected, the iris is actually most affected, with large iris granulomas seen in this condition. So it has to be a little mix of questions that are easy and some that will confuse you. All right, what is the best imaging modality for a CCF? CT, MRI, MRV, MRV has a few people, or DSA. DSA has the most people, our neuro-ophthalmologist, pediatric ophthalmologist also has got it right. It is DSA, digital subtraction angiography, which outlines, removes any other vascular, any other soft tissue lesion and focuses only on the vascularity. It is, while you may be able to pick up a CCF in all of the four, I was stressing most on which has the investigation that has the highest rate of giving you the positive outcome. So even small, low flow CCFs will be picked up by a DSA. As you would expect, that's also the most expensive of these investigations. So sometimes economics may decide what we can do, what we cannot. Floppy iris syndrome, which we, even if we don't get, we can create on our own sometimes as residents. What is the most important risk factor in this? Finasteride, CCB, tamsulosin, or ACE inhibitors? Tamsulosin, everybody got it right, that was simple. And most common inherited cause of pediatric cataract? Stickler, Lowe syndrome, connection 50 mutation, Marfan syndrome. I will not raise my hand for this question. It is the connexin 50 mutation which causes the most, well, actually all of them can be associated with pediatric cataracts. The most common inherited cause is a connexin 50 mutation. All right, this is simple because even if sometimes the patient doesn't have it, the KOH mount sometimes is contaminated with this, that gives you a positive result in all cases. The traumatic fungal ulcer, which is associated with the most commonly seen organism, Aspergillus, Fusarium, Candida, Carvelaria. Carvelaria sounds like a Malayalam word. It is Aspergillus, and I'm surprised I think people are quietly confident but not raising their hands. No, very quiet performers. Okay, what percentage of population have a cilio-retinal artery? 8%. Okay, 1, 2, 3, 4, 5, 6, 7, 8 hands have gone up for 8%. 13%. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. One more hand should have gone up. We have only 12 hands. 25%. And 33%. Other people are saying they don't have cilio-retinal artery. It's 25%. A fourth of all patients have a cilio-retinal artery. And below what CD4 level is CMV retinitis seen? Less than 100? Less than 200? Less than 50? Or less than 400? You can't say that I have written 400 and all three options are also below 400, so you have to give me no. They're looking for a specific answer. It is less than 50. A few hands that actually went up got it right. What is the drug of choice for CMV retinitis? But from what I understood, valcyclovir or galcyclovir. Which is better? Which is the pro drug? That is correct. In Marfan syndrome, which subluxation is most typical? Inferonasal, superotemporal, inferotemporal, superonasal. Okay, raise your hand if you can tell me the full mnemonic that talks of both the kinds of subluxation in the two conditions that we know about, that we most commonly discuss. All right. If you come up and tell on the mic, it's okay even if you get it wrong.
Marfan's is superotemporal and homocystinemia is inferonasal.
What is inferonasal?
Homocystinemia.
Okay. Introduce yourself, please.
I'm Dr. Khalid from Amrita.
From
Kochi.
Amrita. Final year resident?
Yes, final year.
He's got it right. Marfan is superotemporal and homocystinemia is inferonasal. So that's the mnemonic or the two kinds of subluxation patterns that we see. All right. We come to the pictorial answers. So if you think you know this, you can raise your hand. If your luck is good and I call upon you, you'll get another audience prize. So what is this condition used to treat? No, raise your hands. I don't know. Okay, this question is gone. So this is a lesson for the audience. If I hear in an audience question or the question for the participants, if I hear the audience shout out the answer, nobody gets a point. And you may have a team there, but don't do this as like a negative tactic. Oh, I don't want them to win, so I'll shout out the answer. But remember, we are assessing the teams here, not assessing your loudness of the voice. So please be a little more considerate. It is strabismus or squint. It was believed that making slit-like openings or one narrow opening or making them look divergent can automatically correct it. All right, question 2. Raise your hands if you think you know it's right. Okay, I saw the lady in white raise her hand first. So, holds paper on subretinal photovoltaic cell, implant to restore vision in which group of patients, ma'am? Right to your next, there's a mic right there.
Age-related macular degeneration.
I want a better answer. Can someone raise their hands if they have a more specific answer, ma'am?
Geographic atrophy.
Geographic atrophy due to AMD. Please introduce yourself.
So I am Dr. Krishna Priya, final year resident, Travancore Medical College.
Congratulations to Dr. from Travancore Medical College. A round of applause. This paper just came out last week in NAGM. It is only in the select group of geographic atrophy due to AMD where they were allowed to, where they performed this surgery. Okay, hands up for if you know what this device is. Nobody knows this device. There are no negative marks, man. And it's okay, you can still take a chance. Okay, now shout out the answer, I won't look. See, someone said Jones now. So you could have gotten a prize. This was a Jones tube. This is used in conjunctival DCR or CDCR, or even any case where there is a common canalicular, bicanalicular, or a lacrimal sac adhesive pathology where the sac cannot be accessed and you create a direct passage from the conjunctival cul-de-sac to the nose. Okay, hands up for this question. All right, so that gentleman at the back with the, you. Yeah, I saw your hand go up first. Malyugin ring, so he gets an audience prize. You can introduce yourself. You have a loud booming voice, so.
I am Dr. A.C. Raghu, working at Government General Hospital, Thrissur.
All right, congratulations, sir. That prize is for you. This was a Malyugin ring or a Malyugin expander. For the last question, you can raise your hands if you know what drink this reminds you of. Okay, I saw there that hand go up. Ma'am, you in the sari? Coca-Cola. And we have a Coca-Cola like gift for you. Ma'am, please introduce yourself there. It's the Coca-Cola bottle sign. Unfortunately, nowadays we don't see this Coca-Cola bottle. This was the traditional glass bottle that was available then.
I am Dr. Mallika from Government Medical College, Thrissur.
Government Medical College, Thrissur. Congratulations, Dr. Mallika. Coca-Cola sign was correct. So this is of course typically seen in thyroid associated ophthalmopathy or dysthyroid ophthalmopathy. So with that, we've completed our 25 questions and our team of volunteers is working to get the answers ready with us in the next few minutes. So if you all want to take a break for 5 minutes, go have some water and come back, and I will see you in 5 minutes here. Meanwhile, we have 5 teams, so we'll need 10 chairs.
Before I announce the top 5 team, I request you all who have stuck the posters in the poster area, please remove it once this quiz program is over, because it is really difficult for us to remove all of them. Okay. So all of you have done well, and there was a tie for 6 teams to select the 5th position. Okay, so 6 teams got the same mark in the for the final. So any guess? Okay, I'll read the names. Dr. Jasmine P. Baby and Dr. Shruti K. Thomas from TD Medical College, Alappuzha. Please come. No, they need to take a lot.
Okay, but that's the tables are faced by the buzzer.
Okay.
So this is the 5th team or the first team?
The first team.
So then they get to choose which they want to be,
it's
A,
like
B,
that.
C, D, E.
Okay. So you can choose where to sit. Dr. Jasmine P. Baby and Dr. Shruti K. Thomas. A, B, C, D, E.
Team that gets the highest mark gets the choice to sit right now.
Yeah.
So don't worry, no team has any advantage or disadvantage, and just to equalize everything, we give you the choice. So you
so
can't
this is
say that.
C.
See, all right.
Now, next team is from Trivandrum. Dr. Anjana P. and Dr. Shaina N.A. Chaitanya Eye Hospital, Trivandrum. Again, from Trivandrum.
Sir, I think our partners want to give each team that has come into the finals a gift.
Yeah.
So,
Again from Trivandrum, Dr. Jasila VH and Dr. Anju RS, RIO. Next from Trishur, Dr. Elsa Maria Kurivila and Dr. Hridya Dominic from Amala Institute of Medical Science, Trishur. So one more team. Any guess? It's from Kottayam. Dr. Sanjana Vinod and Dr. Parvati C. from Government Medical College, Kottayam. You are from Kottayam? Please. No, wait. Where is the okay. Wait. Where is Elsa and all? Dr. Elsa Maria Kurivida and Dr. Hridya Dominic, Amala Medical College, Trishur. Yeah. Talperile. Finally, you want? So you have two options. You can sit here or here. Okay. Yes. So you have only this option. So where? Here.
okay.
Okay. So just give the mic to the team. Please introduce yourself.
So team A, for our scorers here, please have a look. Please introduce yourselves.
I'm Dr. Anjana. I'm from Chaitanya Eye Hospital, Trivandrum.
All right. Team A from Chaitanya.
I am Dr. Shehana from Chaitanya Eye Hospital.
All right. So team A is Chaitanya Eye Hospital. Team B.
I am Dr. Anju from RIO Trivandrum.
All right. Team B is RIO Trivandrum. There's always an RIO team here.
I am Dr. Jasila from RIO Trivandrum.
Congratulations. A round of applause. These are the toppers who've made it, the top 5.
I am Dr. Shrudhi K. Thomas from Alappuzha Government Medical College.
All right.
Dr. Jasmine from TD Medical College, Alappuzha.
From Alappuzha Medical College.
I am Dr. Sanjana from GMC Kottayam.
All right.
I am Dr. Parvati from GMC Kottayam.
Congratulations. And our team, 5th team?
Dr. Hridya Dominic from Amala Institute of Medical Science, Thrissur.
Trishur.
Dr. Elsa Kurula from Amla Medical College.
Excellent. So 5 different cities. We've got 4 different cities. We've got Trivandrum, we've got Alappuzha, we've got Kottayam, and we've got Thrissur. It's a great mix. And not surprisingly, no male in the mix. So, well done. All right. So what we're going to do is spread this out over 5 rounds, and I'll briefly go over the lists, the rules that we have. So our rules are very simple. Remember, if there's any doubt, our adjudication as a quiz master remains final. See, this is a quiz that is just used to assess how you all are performing today. It is meant to entertain a little bit and also educate a little bit. So we call that a little edutainment here. And it is an assessment of today. Remember, it is just your performance today that we are checking. It could be luck, it could be a question you read that you forgot. It does not mean who's the better surgeon, who's the better doctor. Don't let that competitive streak get to you. Just have fun and enjoy. We're going to have 5 different rounds. You can see you have a mic, you have a buzzer, you have a pen and a paper. So we'll be using all of this today. And if, just for the audience, we love your support and encouragement. So we'd like applause from you whenever there's a right answer or they answer something extraordinarily correct. What we don't want is your participation during the quiz. So please do not scream out the answers. That will put off the team that is receiving the question at an advantage and the others at a disadvantage. And finally, if there's any doubt, always refer to rule number 1. All right. So with that, we have about 50 minutes, which is enough. Mic check, we've already checked our mics, we've introduced our teams. We'll quickly do a buzzer check. So team A, Chaitanya, can you press the buzzer to see? All right. B, can you press the buzzer? Great. C. Okay, D. And E. All right, so now when I say go, I want all 5 of you all to press the buzzer and let's see who gets it first. 1, 1, 2, 3, go. All right. So this is how the buzzer works. When you all press it first, the one who presses it the first, when you all go it simultaneously, will show up. So here we don't have someone who's watching and seeing whose hands go up. And we'd like our scorers to introduce themselves. They have their mic, yeah.
I'm Dr. Soumya.
Dr. Soumya.
Dr. Anupama. Dr. Tittu. Hi, I'm Dr. Emya.
Excellent. So, a superb team of quizzers, even the scorekeepers, even the scorekeeping team doesn't have a male in it. So, but, ophthalmology is that way. All right, so all set. So round 1 is easy pickings. We're just having simple questions put up. This is to get the juices flowing. This is simple questions to open your accounts, get points. Do not overthink, do not overanalyze. Sometimes you'll wonder, this is a first year question, why are you asking me this? It's okay. There is no negative marks. What we do have is something known as infinite bounds, which means that if team A gets the answer correct, the next question will go to team B. If they don't answer it, it goes off to C, goes off to D, goes off to E. If E answers it, the next question starts with the next team. So this way, it does not, sometimes when you have a very strong team in front of you, they answer every question that comes your way, and that can affect your luck. So that's why, to even it out, this is infinite bounds. So if you answer a question, the next question, direct question, goes to the team after you, so that they also get a chance and it equalizes the playing field. So with that, we start with team A, Chaitanya. Your first question for round 1. Which investigation would give you this output?
Specular microscopy.
Specular microscopy is correct. First points on the scoreboard. Team A gets plus 10. Remember, this has got no negative marks. This is good. This is good to get people warmed up. Question number 2 for team B on your screen. What's your diagnosis?
Ischemic CRVO.
Ischemic CRVO for a bonus prize or brownie points. What's the classical appearance called?
Thunder splash. Blood and thunder appearance.
Blood and thunder, something more edible?
Tomato splash.
Tomato ketchup, splashed ketchup appearance. Ischemic CRVO with a tomato. Please, audience support. The last thing you want is, teams that don't have points on their scoreboard. So we want everybody to open their accounts, and the rate, the speed at which they're answering shows how well they're prepared. Team C, Alapura, this is for you. Which muscle is associated with Marcus Gunn jaw winking syndrome, as it is believed to send the misdirected signal to the LPS?
Masseter muscle.
Masseter is what I heard. It is incorrect, so we move to team D.
Pterygoid.
Pterygoid, team E.
Medial pterygoid.
Medial pterygoid, team A.
Lateral pterygoid.
Lateral pterygoid or the external pterygoid is what we were looking for. We're looking for a little more specific answers here. So team A gets plus 10. There is no lesser marks for pass here. Everybody gets a direct question. So Chaitanya scored their second question of this round. The fourth question of this round to team B, RIO Trivandrum, this is your question. The arrow points out to a finding seen in a patient who's had a history of trauma. What is this finding?
Berlin's edema.
I'm going to move on to team C. Okay, you've had the time to answer team D.
Commotio.
Commotio retinae. Berlin's edema specifically is at the posterior pole or the macula. Commotio retinae is what we were looking for. Team D gets plus 10. So GMC Kottayam, you get your answer back and you're on the scoreboard. Team E, this question is for you. Amala, this small little thing on the tip of their finger, do you know what it is? There are no negative marks.
Suprastent.
Suprastent is what I heard. That's the wrong answer. Team A.
Ganciclovir implant.
Ganciclovir implant. Good out of the box thinking. Team B. RIO Trivandrum. So for past questions, I can't give you that much time. Alapura.
Eye stent.
Eye stent is what I was looking for. Eye stent is the word. It's a glaucoma drainage device. You can see the audience is appreciating. Plus 10 to team C. Great. So question number 6 to team D. GMC Kottayam. Who was this Google Doodle celebrating? So a few years ago we had this Google Doodle pop-up. You'll know what a Google Doodle is when you go to the Google homepage. You have this design that is used for commemorative events to celebrate people, their births, their deaths, their achievements. They don't have an answer, so we go to team E.
Aravinda Institute head.
We go to team A. Who is this Google Doodle celebrating? You have had the time that the previous teams have had. Please be ready with your answer. Team B.
Venkataswamy.
Dr. G. Venkataswamy. He is the founder of Aravind, but the question was, who is this Google Doodle celebrating? Plus 10 to team B. And the next question goes to team C. Alapura, this is your question. What is this post-surgical adverse occurrence that you see in this picture here? Team C, your question for plus 10. No negatives.
Corneal infection.
You need to be loud so I can hear.
Corneal dystrophy.
Corneal dystrophy is incorrect. Team D. Right. Team E.
SPK.
SPKs is incorrect. Team A, your answer if it's ready.
Excess use of topical. Excess use of topical medication.
Excessive case of topical, excessive use, no. Team B, or no. So all right. Anyone in the audience can raise their hands if they think they got the right answer. We got Sands of Sahara, but what is the condition? Epithelial ingrowth under the flap. Sands of Sahara appearance, which is post-LASIK epithelial ingrowth. We'll give our first audience question there. So the sixth team is the quiz master and the audience. We are the sixth team. When the teams on stage don't get it, we get the point. Congratulations, ma'am. All right. So this is a tough one for people in training. You may not have seen this, but this is a picture from the AO BSCS series. So, I try to keep pictures if I'm sourcing them from common sources that you may have read. Question A, I'm sorry. The same question, we started with team D, right? Team C. So this question comes back to you. Thank you so much. What do the arrows indicate here? Team C.
KF ring.
KF ring. What is the KF ring? Full form?
Kaiser-Fleischer ring.
Kaiser-Fleischer ring. That is correct. So Team C finally hit one out of the park. Alapura gets plus 10 for Team C. Team D, this is your direct question. Question number 9. What are we looking at? It's as simple as that. And again, my rules remain the same. Don't overanalyze, don't overthink.
RCS thickening, posterior scleritis.
Posterior, no, what are we, what?
B scan.
Yeah, and what do we see in this B scan? Just a simple word we need. You're going around the diagnosis, but the audience already knows what I'm asking.
T sign.
T sign is all I needed to hear. You were right around it, and I could not have moved on if you had said posterior scleral thickening is scleritis. T sign or subtenon's fluid is what we are looking for. Team E, your direct question for the participants from Amala. This is a child and has come with proptosis. You've done imaging. What is your likely diagnosis based on this image? The hint is that it's a child with visual impairment. Your question, answer?
Optic nerve glioma.
Don't be so worried about it. It is an optic nerve glioma, plus 10 to team E from Amala. So that was good. We got 9 out of 10 questions answered with only one bouncing off to the audience. So that's a great start. A round of applause to the teams who've come up on stage, showing us why they should be here. All right, our scorer team, can we have the first round of scores?
Team A 20, Team B 20, Team C 20, Team D 20, Team E 10.
There you go. So everybody's opened their account, and a difference of 10 is nothing. Each round gives you the opportunity to score up to 70 or 80 points. So you've got enough to do. All right, audience, I need only your participation here. And we have one prize ready for you. This company was started as a small pharmacy in Fort Worth in US by 2 pharmacists, William Connor and Robert Alexander. They started making sterile ophthalmic products which no other company was making. Over the past 40 years, they have got $10 billion in revenue and control 65% market share in the ophthalmic instrumentation and machinery space. What is this company that we know today? Yes, who said that? You just walk in and you answer it right. What swag, what style. Give the gentleman there, sir, please introduce yourself.
I'm JP.
In as stylish as a way possible, JP just gets the audience question. The answer, of course, is in the question. Alexander and Connor became Alcon, and that's the company that we know as today, who controls everything, including our income. All right, so from the audience back to the team, we've gotten our score check done. This is our round 2. And we start with team B here, because this is an infinite bounce. 8 questions. These are slightly more difficult. We raise the interest level by adding plus 15 for a right answer and minus 5 for every wrong answer. Remember, pass is an option, so you don't lose if you're not sure. As always, infinite bounce equalizes the playing field. So team B, RIO Trivandrum, this is your question. Ready? Based on this imaging CT of the CT scan, what is one word that comes to your mind which also describes a piece of photography equipment? Team B, RIO Trivandrum. Pass. Team C, Alapura.
Pass.
Pass. Kottayam. You're raising the bar, so pass. Amala.
Pass.
Pass. Chaitanya.
Pass.
All right, for our second audience question, we have this gentleman standing up there. Tripod is the word we were looking for. You can introduce yourself. And our audience will get a prize.
I'm Dr. Hari from LF Angamali.
Dr. Hari from Little Flower, Angamali. Tripod fracture, it's the zygoma, it's the zygomatic arch and the superotemporal edge. That entire bony fragment is detached and forms a tripod fracture. So one more point to the Quizmaster audience team. All right. Teams B again, this is your direct question. Which agent used in oncology inhibits VEGF-A, VEGF-B, PIGF simultaneously and is relevant in anti-VEGF therapy? So which agent blocks all the VEGFs? Team B, your direct.
Pass.
Pass. Team C. This is not that difficult.
Bevacizumab.
Bevacizumab is incorrect, so they get -5 to Team C. Team D.
Pass.
Team E, Amala.
Faricimab.
Faricimab is incorrect, -5 to Team C. Team A.
Aflibercept. Aflibercept.
Aflibercept is the word I was looking for. So +15 to Team A, they get it right. Aflibercept inhibits VEGF-A, VEGF-B and PIGF. It's a recombinant fusion that traps all the VEGF and therefore neutralizing these growth factors. Because Team A answers it and we started with Team B, your direct, again, question 3 is for you. So clearly we are seeing the lens and seeing the structures around it. What is this technique of viewing or this angle of photography called? Team B, your direct question.
Pass.
Pass. Team C.
Pass.
Pass. Kottayam.
Pass.
Pass. And Amala.
Pass.
Pass. And Chaitanya.
Pass.
All right. Audience, all right. We saw the first hand go up there was there. So please, ma'am. Miyake Apple View, a big round of applause. That's a tough one that she's hit out of the park. Ma'am, please recognize yourself and get your award.
I'm Dr. Deepthi from RIO Trivandrum.
And this is your second prize of the day? Okay, so that's the limit. No more prizes for you. The Miyake Apple View is actually only a technique for research purposes where the posterior view of the anterior segment is photographed in a back to front view only on post-mortem eyes, mainly to observe surgical manipulations and to assess where the lens is positioned and what complications happen. So whenever you've seen a new lens come out, remember they have been studied and documented a lot, especially through the Miyake Apple views. Dr. Apple, or David Apple, was also the official biographer of Harold Ridley. All right, so Team B again. What is your diagnosis based on this bilateral fundus photo? Pusher's retinopathy for the first direct tough round question. Team B have gotten it right. So RIO gets +15 for this one. Team C, your direct question 5. What is one word that describes these pictorial representation of these images? We often see this and we don't know what it is. But if you read a little bit more, you'll get what they are describing or what is this all about. You can just let me know. It's a little, even if it's a small, longer explanation, I'm willing to understand. Wait. What do you think this is? There's one keyword that I'm looking for. Okay, I think we'll have to move on to Team D. Kottayam is choosing to pass, so we go to Amala. Also pass. Chaitanya.
Pass.
Passing. RIO Trivandrum. Passing. All right. So anyone in the audience? All right. We'll go with someone who's not answered before, sir. Aberrometry, but what is this portrayal? Zernike. Zernik's polynomials. Prize for the sir there. So please introduce yourself for the audience.
I'm Dr. Kiran Balagopal.
Dr. K.R. Balagopal. Zernik's polynomial representation of corneal aberrations. He explained it with both the words, keywords, aberrations and Zernike polynomial representation. So we come back to team C. Alapura, your direct question is, this is the fundus photo of an unusual finding. What is your diagnosis?
Wyburn-Mason syndrome.
Wyburn-Mason syndrome plus 15 to team C. So team D, Kottayam, your direct question, question 7 is, what is the name of this instrument? Give me the, think about it, give me the full name of this instrument. Okay, your answer?
Hurdles, exophthalmometer.
So -5 to team D. Amala, your chance.
Ludes.
Ludes exophthalmometer or double Ludes exophthalmometer plus 15 to Amala. And the last question of this round goes to Chaitanya, team A, on infinite bounds. This is your question. If giga is 10 raised to 9 and mega is 10 raised to 6, how do you write femto? I know it's a maths question, but we keep saying femto, femto so many times. What is it? What is femto?
Pass.
Pass, team B. Pass, team C.
10 raised to 15.
10 raised to 15. I heard audience clapping. -5 to team C. Team D is incorrect. And team E, pass. Anyone in the audience?
Sir,
all right,
already
our lady
written.
just behind team C. 10 raised to -15 was correct. So giga is actually 10 raised to 9. Mega is 10 raised to 6. Our lady in the background, please introduce yourself. Dr. Parvati from Chaitanya. Femto is measured as -15, -15, basically 10 to the order of -15. That fraction of a second is the femtosecond, which is the something to do with the LASIK. I have not done a single LASIK in my life, so I wouldn't know that. All right. So now we won't go stop for the quiz, for the scores. We'll keep a little suspense. We go to this round that I love. It's called the progressive round. Again, you've got 8 questions. Each question has 3 hints. They are absolutely obscure. They're absolutely out of the box, unusual questions, sentences that you'll hear. But if you can tell me the key word after the first hint, you get +15. But if you get the wrong answer, it's -10. If nobody answers or people get it wrong, we move on to the second hint. I'm sorry, that's not +150, that's +15. So actually +10. +10 after the second hint and -5 if you get the wrong answer after the second hint. But if you answer correctly after the third hint, it's +5 with no negative marks. So you can raise your hands because multiple teams can answer at the same time. And I will come to you and you need to write the answer on your answer sheet in a legible handwriting, and only the first answer that I see will be considered. If at the first hint you get it wrong, no problem, we move on to the second round. You can, second hint, and you can try again. All right? Please audience, I love your participation and enthusiasm, but no prompting or shouting. To just give you an example, hint number 1. This part of southern India is often misspelt or mispronounced in other parts as the Hindi word for bitter gourd. So you get the hint, you get the idea. The great Indian hornbill is the state bird of this place in India. See, this you didn't know about your own state. Also known as God's own country. So, all the thing that ties all together is Kerala. Oftentimes you will hear North Indians call it Karela or Karela, Kerala, or something that sounds as bitter as that vegetable. The great hornbill is the state bird, and this is God's own country. All right. So now you get the idea of what we are talking about. So what we are going to do is I'm going to use a hand mic. Okay, so your first hint, like I said, raise your hands if you can. I will come and see what your answers are written. No, I think I'm okay. Let's go. So I connect on my phone. Hint number 1. Archers in 1800s England were said to practice archery by using the skulls of large farm animals and would aim to shoot the arrow through one of these skull openings, giving rise to a popular phrase which is even in use today. Based on this hint, does any team have the answer? So archers, to learn how to do target practice, would keep the skull of farm animals and try to hit it through one of the openings to refine their skill. This phrase is used even in common parlance today. Okay, I think we waited long enough. So nobody goes for plus 15 minus 10. Second is the history of this drug goes back to the people of Peru who used the bark of the cinchona tree to fight chills and fever in the 17th century. This drug has antiviral and antiparasitic and lymphocytic properties. Keeping the first hint in mind, what do you think is the right answer here? No hands are going up. All right. So we move to hint 3. So this is here we are playing only for plus 5 now. The genetic eye disorder that causes progressive vision loss, primarily affecting the central vision due to damage in the macula. This is your fundus photo. Mutation is the ABCC4 gene. Team C has raised their hand. I'm going to have a look at what they've written for us. No, put all the questions, put all the hints together and give me the answer. Think out of the box. This is the first answer of this team. So anyway, there's no negative marking. That's the wrong answer. Think of the hint that ties the 3 clues together. Team A is going for it. Chaitanya is incorrect. I think they're around the right answer, but not quite. This is also not correct. Okay, so the other 2 teams have not gone for it. I want someone in the audience to tell me, all right, sir, if you can explain to me what we were trying to get at.
I think the archers were trying to hit the bullseye.
It is bullseye.
And it is quinine, which is the drug.
That's right.
Bullseye maculopathy.
Absolutely. So, sir has gotten it right. It is bullseye maculopathy. So, what we were looking for is archers were putting the skulls of bulls and trying to hit the arrow through the orbit or the socket. And that is why even now in archery, getting the right answer, that's your limit, sir. Now, no more. Bullseye. Chloroquine or hydroxychloroquine, both derived from cinchona, are known to cause bullseye maculopathy. And again, what was this? Stargardt's, also known to cause bullseye maculopathy. So, try to put the clues together. Just don't give me this answer. Keep in mind the hints. I got Bess, I got Vitelliform, I got Stargardt's. Everybody were writing what they saw here, not putting the link together. All right. So next question, this was bullseye maculopathy. This is a type of shotgun ammunition that contains large number of very small spherical bullets, primarily used for hunting small animals and for target shooting sports. Because if you use this bullet, it gives you multiple of these pellets that hit different targets. So, the target is going to get hit any which ways, and it's not a single one that goes. So like I said, the first clue has to be a little tough because you get plus 15. That will possibly put you into the lead. Nobody here has gone for it. Our hint 2 is this condition is strongly linked to HLA 29, which affects 95% of the people. Write your answers, don't tell me. All right, so team E gets plus 10, and team B has written their answer as well, which is also correct. So team B gets plus 10 as well. And we move on to the third hint, which is the classical appearance. So apart from team B and E, you all can, A, C, and D can participate. C gets plus 5. D also gets plus 5. And Chaitanya has chosen not to answer. Audience can shout this out. Bird shot. That is correct. So bird shot, bird shot. In this condition, these ammunitions, they are called bird shot because if you see a bird and try to hit with one bullet, chances are you may not hit it. So they use these pellets that disperse out, and you almost always get a bird shot, and you can see why this pattern is seen in the fundus, and that's why it's got the name bird shot. All right, so question number 3, hint 1. This is a sweet fortified beverage from the Douro region of North Portugal, and the beverage itself is named for the town of Oporto, where it is aged and bottled. Oporto in Douro of Portugal produces this sweet fortified fermented beverage, and the name is derived from the town of Oporto, where it is aged and bottled. All right, so team E is going for a gamble with a plus 15, and they have gotten it right. A big round of applause. That was abstract thinking that they got it right with the first hint. So this is what we talked about, thinking out of the box. For the other 4 teams, this is your next hint. This is the most common neurocutaneous syndrome after neurofibromatosis and tuberous sclerosis. So team D get plus 10, and team C, who raised their hand, also get plus 10. And team B, are they going for it right now? They also get plus 10, and team A is not answering this one, or are they? Okay. They lose 5, so minus 5 to team A. So team A, this question is, this third hint that we have coming up on the screen is only for you. This syndrome affects the face, the choroid, and the leptomeninges, and facial lesions are seen in the region of the trigeminal nerve. Because it's only you left, you can answer it on the mic if you are answering it, or else we bounce it off to the audience. No? Audience? Sturge Weber. The beverage is port wine from Oporto, and kudos to Team E to get port wine and connect it with Sturge Weber. Well done. All right, question number 4 is this. Dash is the word referred to a Roman soldier who is in charge of 100 other army men under them. I'm hearing whispers of the answer from the audience. Okay, I'll move on to hint 2. This condition was so called because of the similarity in the nasal bridge and the structure on the nose between patients that doctors saw and the description of Roman warriors based on their sculptures and paintings. So they had a very similar nose bridge and the appearance of the nose and eyes, and that is why this condition is also called something related to do with these peoples. Audience, I am seeing a few members get itchy, they know the answer. All right, so for plus 5 and no negative marks, Your third hint is the dash system has active sentry technology, which is the first and only handpiece with a built-in pressure system. The active sentry measures active IOP while you're operating and prevents surge and fluctuations. It allows surgeons to operate at more physiological IOPs. Yeah, I have a feeling residents may not be aware of these terminologies, but maybe the first or second hint was a little helpful. Okay, so you already got a prize. I'm looking for someone who's not gotten a prize. Yes, ma'am, you were raising your hand. Centurion is the word we were looking for. So, a person who has, so an audience prize over there. Yeah, all right. So centurion syndrome, centurion is a person, Roman army man who was in charge of 100 people, century. The centurion syndrome is the idiopathic displacement of the medial canthus leading to outturning of the punctum and seen in people with a big nasal bridge. And of course, you have got Alcon's centurion system, which has the sentry technology which measures IOP while you are operating. So centurion was the word we were looking for. Question 5, hint 1. This is a German ophthalmologist. If you've seen his picture, you should know him. He worked on glaucoma, trauma, and cornea, and all of these three fields have things known with his name. For plus 15, minus 10. Do we have any participants for plus 15, minus 10? No one? All right. We move on to plus 10, minus 5. I have marked out a small area. This field defect has his name. All right, team B raised your hands, team E has raised their hands. Let me see B first. B loses 5 and team E had raised their hand. Okay, they also lose 5. So anybody else trying on hint 2? Okay, for hint 3, please raise your hands if you think you know it with your third hint. Okay, team C raises their hands and they get plus 5, and team A, Chaitanya, also gets plus 5. So we have 3 other teams who have not answered this. And I'll now move on to the audience. Seedle there. I didn't see someone who answered it, so I think I'll take this prize. Thank you. Seedle was the word we were looking for. This is Eric Seedle, Siedel's scotoma, and Siedel's test. The small hidden scotoma is the Siedel's scotoma. The big large one is the barium scotoma, which everybody had actually written. All right. Connect question 6. This is a classical picture, an oil on canvas painting of pigmentary findings on the posterior pole due to onchocerciasis. This clinician was the first to document onchocerciasis in Africa, and they didn't have fundus photo pictures that time. He used to painstakingly draw them oil on canvas. This is one of the few things that he's not famously known for, but this is one of his first clinical contributions. Team E going for plus 15, minus 10, and they get plus 15. They know their history well. Your next hint is this. His statue is the only ophthalmologist that features across all the Madame Tussauds museums. This gentleman is in the Sydney Madame Tussauds. If you've been there, you'll see him. He is one of the least visited statues that you would expect. But he's the only ophthalmologist who is there across all the Madame Tussauds wax museums. A, B, C, D. For plus 10, minus 5. No answers. We go on to the third hint. Rarely known by his first name, Nicholas performed this surgical procedure in the 1950s, but received FDA approval only 30 years later in 1981. Sir Nicholas is known by another name. What is the name? All right, so A, B, C, D are not answering. Audience, Sir Nicholas Harold Ridley, because you already got in your prize, I can give you one more, but that's the answer that we were looking for. It is Sir Nicholas Harold Ridley. He was posted in Africa and India as a military officer. That's where he came up with onchocerciasis. He described nutritional amblyopia and even snake venom retinopathy. The first IOL was implanted in 52, but only the FD approval came in the 80s. All right. Your question 7. This name of the group of drugs is derived from the historical fact that this molecule was first identified in seminal fluid. And because it was also present in seminal fluid when it was discovered, it has somehow gotten its name related to that anatomical region. So think of how this is connected to ophthalmology and ophthalmic drugs. All right, nobody is going for plus 15. One of the teams actually murmured the answer. I heard it, but we go for plus 10 or minus 5. Sorry. Oh. So sad. My phone malfunctioned. So we get to see the question 8 now, the last question of this round. We'll go back to that question for the audience. The etymology or origin of this word suggests it came in the late 17th century. From Latin, when translated literally, it means nipple. Yeah, this is ophthalmology. People are wondering. All right, nobody for plus 15, minus 5, minus 10. Next hint. This word that I'm looking for is also found in many parts of the body, like the duodenum, the heart, the tongue, and the skin. Okay. I'm moving on to plus 5, and okay, team A is the only one. I will not be taking any other teams. We are running a little short on time. Plus 10 for team A. We go on to the third hint now, which is in the eye. We see this in relation to the word that we are looking for. What is this pathway that we see? Nobody going for plus 5? Okay, team A is saying plus 5. I can't give it to you, no negative marks. There's not an answer there. This is not an answer here, and team B has not got the answer right. All right, audience. Okay, last row, the lady in black. Papillae is the answer we were looking for. Papilla means nipple. Papillae are seen all across these body parts, and also cobblestone papillae seen in giant papillae or VKC. Okay, so that missed question that we had was this. This was the first hint. The second is this is an ophthalmic condition seen because of use of these drugs. Periorbital fat, sulcus deepening and flattening of the lower lid. And this is the only group of drugs approved for eyelash production. Prostaglandins were thought to be initially produced by the prostate, and hence the name prostaglandin. Prostaglandin associated periorbitopathy and PGA analogs. All right, so now that we are done with all these questions, can we have the rapid fire round then now? Can we have the scores?
Team A with 45 points, Team B with 50 points, Team C with 45 points, Team D with 30 points, Team E with 55 points.
All right, so based on this, we now move on to a rapid fire round. So team, can you help me with the 5th placed team, scorers? Can you help me with the 5th placed team? D.
Team D.
All right. Team D. So you have 75 seconds. You can also, the time starts after I finish the first question. 75 seconds for me to complete the round. We'll need someone to keep a timer. and tell me when time is up. Even if I have started that question, I will complete it and allow you to answer that question at the end of time being declared. You will have 9 questions, plus 10 for every correct, minus 5 for wrong. You can pass. If time permits, I will come back to that question. If you're ready, I will start. Your time starts with the end of the first question. Scorers and timers, let me know when you all are ready. 75 seconds. This is the last round. So with 90 points on for grabs, everything can change in this round. Scorers, you've got the timer? Okay, let me know the moment time is up. You tell me time's up. 75 seconds, time starts when I finish the first question. Team D, you can pass if you don't get it right. The questions are only verbal. Only last 3 questions will be on the screen. Your first question, Eylea or aflibercept is a monoclonal antibody approved for AMD. True or false?
False.
Is correct. Expand APM PPE.
Acute posterior placoid.
All right, minus 5. Which dye is commonly used in ocular surgery, was first used to treat sleeping sickness?
Pass.
Which drug was investigated in the Marina trial for AMD?
Pass.
Which traditionally followed eye trauma terminology system bears the name of a city?
Pass.
What is the name given to iris lesions associated with neurofibromatosis?
Lish nodules.
Is correct. Whose name is this instrument associated with?
And it's time.
Time is up. All right. There's no answer for this. Audience, Kelly's, Citelli's or Hajek, I would have taken any of the 3 answers. Your 2 questions that you missed was name this condition. Would you like to take this for no points? Nevus of Ota. And what mode of imaging is this? Autofluorescence is correct. Our scorers will tell us what was their round's yield. Not the final scores, just this round.
15.
15. All right. A round of applause for Team D. The team in 4th position is Team C. Team C, your rapid fire. Time starts after I finish the first question. Intravitreal injections of chemotherapy drugs can be used in treating retinoblastoma. True or false?
Yes.
True is correct. Expand DSEK, DSAEK.
Descendants membrane stripping endothelial keratoplasty. Descendants stripping endothelial keratoplasty DSEK. Descendants membrane endothelial keratoplasty DMEC.
Is incorrect, minus 5. Which xanthine-based dye is used to stain devitalized tissue on the ocular surface?
Pass.
A Hollenhorst plaque is composed of what element or what material?
Pass.
Which muscle receives sympathetic innervation and is responsible for eyelid retraction?
Muller's muscle.
Is correct. In an evisceration surgery, absolute alcohol is theoretically used to reduce the chances of what condition?
Pain.
Pain is incorrect. Which ophthalmologist is widely regarded as the father of macular diseases?
Pass.
In a trabeculectomy, you may use this instrument whose name does it bear?
Punch biopsy.
Punch, I can't give it to you. Identify, time is up. I've started, so you can complete this. What is your diagnosis?
OSSN.
OSSN is correct. So they get the marks for this. The question that you missed out was what surgery has been performed here?
That's
Intacs. You could have gotten that correct. Our scorers will tell how much they scored in this round. 15 to team C as well. A round of applause to them. The team in third position was A. A, your direct questions will start now. After your time starts when I finish the first question. Fuchs endothelial dystrophy is mainly sporadic and rarely associated with genetic inheritance. True or false?
True.
Is incorrect. Expand MEWDS, MEWDS.
Multiple evanescent white dot syndrome.
Is correct. Which dye or photosensitizer is used in the treatment of AMD with photodynamic therapy?
Vertiporfin.
Is correct. Which is the most common eyelid cancer in the Indian subcontinent?
Sebaceous gland carcinoma.
Is correct. Which is the only FDA drug specifically approved for eyelash growth?
Pass.
What is the name of the new lenses that extend the range of vision from distant to intermediate but require glasses for fine print?
Extended depth of focus.
Is correct. Which instrument bears the name that it shares with a state in the US?
Pass.
What is this lesion?
Nevus.
Is correct. What investigation is this?
Digital subtraction.
Is correct. Your pass is, which is the only FDA drug approved for eyelash growth? The name of the drug, not the group. Is pass. So, with all questions done?
55.
Yeah, time.
How many questions did they get right? What's the score yield from this round? 55 points for team A. So you see the fortunes can change. The team B, your direct rapid fire round will start, time starts after I finish the first question. Hofer Q is the traditional gold standard formula for eyes with lesser axial length or short eyes. True or false?
Pass.
Expand the acronym SMILE.
Pass.
In asteroid hylosis, the vitreous particles are made of which commonly occurring element?
Cholesterol.
Is incorrect. Dysport, Xeomin, Myoblock are all marketed names for which drug?
Pass.
The surgery CARES, corneal allogenic intrastomal ring segment, is performed to treat what condition?
Pass.
Which is the most common primary malignancy of the orbit in children?
Rhabdomyosarcoma.
Is correct. This instrument shares its names with a famous Irish whiskey. What is the instrument's name? The full name?
Pass.
What is this lesion that we see here?
Salmon patch.
Salmon patch.
Lymphoma.
Lymphoma is correct. What investigation modality generates these maps?
Pentacam.
Pentacam is correct. Hofer Q is traditionally used for short eyes with legs axial length. True or false? True or false? Since I've started, I'll complete. Pass. All right.
25.
25. They played it very safe. Hofer Q is used for short eyes as the gold standard. SMILE is small incision lenticule extraction. Asteroid hylosis is not cholesterol, it's calcium. CARES is used for keratoconus. And this is, any whiskey drinkers? Jameson's muscle hook. Also the whiskey. They got these two right. Salmon patch, salmon pink patch, I would have given it to you. All right, so our last team for is team C, right? Team E. All right. So Amala, your set of 9 questions starts with the time after I finish the first question. EDOF lenses work on the principle of single elongated focal point rather than several foci. True or false?
False.
Is incorrect. Expand Azure, AZOOR.
Pass.
Pass. Apart from KOH, which stain specifically is used for diagnosing acanthamoeba keratitis?
Calcofluor.
Calcofluor is correct. What is the inheritance pattern of Leber's hereditary optic neuropathy?
Mitochondrial.
Is correct. Which organism is most commonly implicated in canaliculitis?
Pass.
Which drug is a selective Rho kinase inhibitor used to control open angle glaucoma?
Ripasudil.
Ripasudil is correct. In your lid surgery, you may require this instrument. What is the full name?
Pass.
Identify this condition.
Morning glory syndrome.
Is correct. What test is this?
Farnsworth 100.
I'll give it to you. Farnsworth 100. Expand AZOOR, Azure.
Pass.
What is the organism most commonly implicated in canaliculitis?
Time.
Time. All right. With that, we'll get to know their round scores.
This team 45.
Plus 45. All right. Well done. Azure is acute zonal occult outer retinopathy, and the most common organism in canaliculitis is actinomycetes. All right. So while our scorers are working on the final scores, we had some tiebreakers in place, but I don't think we'll need them. I'll wait.
Scores are ready.
Scores are ready. Do we need a tiebreaker? Yes. Okay, great. So can we have the scores, please?
Team A with 100 points. Team B with 75 points. Team C 60 points. Team D 45 points. Team E 100 points.
Okay, so the tiebreaker is between
Team A and Team E.
A and E. All right, and that is for second place. First place. Okay, great. Just disconnect me, please. Okay. All right. So our tiebreaker questions are here with me. All right. Your tiebreaker questions are buzzer questions. Team A and E, can you all check your buzzers? A. All right. Disconnect that. E. Okay, great. When I mention the question, at any point you can hit the buzzer. If you get it right, that team wins. If you get it wrong, if you get it right, your team wins. If you get it wrong, the other team automatically wins. This is sudden death. All right? Right. No pressure. All right. Your question. Retisert and Utic are names of intravitreal steroid drug implants. What drug is injected in these vehicles? All right. Nobody's answering that. Luckily, I have a couple more. What is the most important measurable factor that determines the choice of surgery in ptosis correction? Team A.
LPS action.
LPS action is correct. And they go through, so our tiebreaker is sorted. Thank you. I had only one more tiebreaker question. All right, sir, if you can announce the winners and have the prizes out.
Thank you, Dr. Akshay. Thank you once again for conducting this quiz program in an exemplary way. On behalf of the Scientific Committee and KSOS, please come and accept this memento.